Welcome. I'm going to take you on a short walk through some of the highlights and considerations in the journey of taking a medical practice from a paper-driven system to a fully integrated electronic health record. According to a recent survey, over 20% of office-based physicians were already using electronic health records by 2005. Larger groups have tended to adopt systems faster than individual physicians, with only 4% of individual physicians using an EHR system. Over the next few years, however, upwards of 100,000 physicians may be making decisions about adopting an EHR system. In fact, with incentives from the federal government, adoption rates may increase significantly. So, it's time to ask yourself the question, am I in a position to take advantage of these incentives? As part of the HITECH Act provisions in the American Recovery and Reinvestment Act, more and more resources are being made available to physicians to implement electronic health record systems. In short, the Act provides for 5 years of incentive payments per eligible physician. These payments are equal to 75% of the Medicare allowable charges for covered services provided by the physician in a year, subject to a de-escalating maximum beginning at $15,000 for year 1 and ending at $2,000 in year 5. However, for early adopters, those whose first payment year is 2011 or 2012, the maximum payment is $18,000 in the first year. Basically, look at it like this. Act now, and you could net up to $44,000 per physician from the federal government. Act later, and that amount can drop by 5 figures. And if that's not enough incentive for you to act quickly, just understand that these payments not only stop in 2016, but beginning in 2015, there are going to be deductions made from Medicare payments to those physicians who have not adopted an EHR system. And those deductions will increase each year, potentially leading to as much as a 5% decrease in their Medicare payments. Now, mind you, there are some qualifications beyond just having or using an EHR system in order to qualify for these incentives. For example, providers will be required to demonstrate what's referred to as meaningful use of EHR technology. Furthermore, there are separate objectives and measures for years 2011, 13, and 15, and these will increase in functionality, sophistication, and complexity over time. So now let's consider that the longer a practice waits to make a move toward converting to an EHR system, the less incentive payments are going to be made available. Plus, their ability to adequately demonstrate meaningful use is going to become more difficult, since in 2013 the requirements are going to become more complex, thereby making it more difficult to obtain the now diminished incentive payments. All this points to the fact that time is ticking, and playing the waiting game is a losing strategy. There have always been a variety of operating benefits that have been associated with EHR systems. We'll call these the old incentives. Now, with the federal government's push to see physician practices convert to EHR systems, there is what we'll call the new incentives. In addition to the incentive payments that we've already partially addressed, the federal government is laying out plans for actually providing affordable loans for those practices that aren't able to pay the associated costs up front. And malpractice carriers may consider reducing premiums for its physicians using EHR systems because of the increased quality of the medical record, often a major issue when defending a malpractice action. Plus, all of the old incentives still apply. However, as good as all of these financial and operational incentives are, not everyone ends up realizing those benefits because, unfortunately, failed installations are not all that uncommon. As a matter of fact, a recent survey concluded that out of all installations, 20% actually end up as deinstallations, with systems being removed or turned off. Reasons most often cited for these failures include technical failures, where the wrong hardware or software combination was installed, cost or other financial reasons, where the expected return on investment was not realized or costs were significantly more than expected, product incompatibility issues, where the EHR system did not interface with existing practice management systems, and people-related issues, where certain physicians or staff members refuse to use the system. This can leave a practice with the worst of both worlds, paper charts for some, electronic records for others, the ultimate fragmented nightmare. So, how do you avoid poor selection that leads to a failed installation? Well, for those trying to navigate their way through the decision-making maze, it's not easy. There needs to be some serious analysis and understanding of the systems being considered so as to ensure that it's clearly understood what in fact each brings to the table, how they compare and how they differ. There needs to be a determination of exact organizational needs so as to know what criteria to base judgments on. Understanding and preparing for the overwhelming impact on day-to-day operations, given that this technology will change the way that a myriad of tasks are carried out throughout each step of a patient encounter, and beyond. Proper planning for the rollout and conversion to a new system, including hardware and software installation, training, and ongoing monitoring. Accounting for how to convert existing data into the new system without disrupting current activity and/or the implementation of the new system itself. Giving enough consideration to the strategic direction that a practice is heading and making sure that the chosen system can grow with it. Finding that balance between not being handcuffed with an inflexible system and at the same time not over-purchasing and getting into a system that far outstrips the needs and exceeds necessary costs. So, how can you avoid a poor selection that leads to a failed installation, especially when failure is no longer an option? The process of selecting, installing, and implementing an EHR system is as big a challenge as most physicians will face. You can avoid the pitfalls by carefully managing the process, but you must find a way for you and your staff to cope while continuing to practice high-quality medicine. Many medical groups or physicians leave the selection, installation, and implementation of the EHR system to the current administrator or office manager. But even a very effective administrator will be challenged to manage a project like this while continuing a day job, and lack of dedicated time and focus is the genesis of a failed installation. A consultant can bring expertise that may be lacking internally to help lead you through and manage the process, from selection of the system to getting the most out of it after implementation, getting it right the first time. When the Fox Group is engaged to assist a practice considering a migration to an EHR system, we approach the process in a very deliberate fashion. We'll start with a highly detailed needs assessment that establishes the criteria to be used in making a system selection. We'll delve into your current operation to identify those features which are most desirable for your practice. And we'll identify those systems that most closely match the needs and fit the criteria that have been established. The Fox Group will develop and orchestrate an RFP for selected vendors to help make comparisons apples to apples, and we'll evaluate the responses to the RFP and analyze how well each vendor matches your criteria. A return on investment analysis will be conducted, which includes initial software fees as well as costs associated with hardware, implementation, long-term maintenance, and licensing. We'll work with you to determine what the best method of acquiring a system is based on your current financial capabilities. And the Fox Group will help to organize and manage each step of the process in implementing a new system and going live, working with the system vendor to ensure a smooth transition and to avoid a failed installation. Finally, we'll conduct a post-implementation evaluation so as to help you evaluate if the system is living up to specifications and your expectations. Converting to a fully integrated EHR system is a major undertaking, but it doesn't have to be a major headache. Properly planned, such a conversion will affect your practice in many positive ways for years to come. That, combined with the current incentives offered by the federal government, and it's easy to see that now is a better time than ever to step into your digital future. If you'd like to learn more about introducing an EHR system into your practice, or about the Fox Group in general, give us a call, drop us an email, or come visit us on the web. The Fox Group, providing excellence to the healthcare community since 1989.